I think where management teams go wrong are behaviors like really big bet the company bets, silver bullets, hopeful thinking as opposed to optimistic thinking. And
magical thinking. I've heard.
Yes. And in a company of our size and scale, we are at the edges extremely innovative. We're always experimenting. We, I think, have a strategy of failing quickly, deciding whether or not an initiative has merit fairly quickly, and then moving on, and continuously through rigorous debate in a variety of settings, continually testing the assumptions of where we're putting our investments, rather than simply getting behind something and writing it right down into the dirt. And I think the one thing you could never say is true about McKesson is that we do not have a single culture at McKesson. We have a single set of shared values, but every one of our offices has a little bit different tolerance for risk, a little bit different tolerance for the ability to engage their market creatively versus traditionally.
How do you, too, work to really evangelize technology's benefits to your customer base?
I think first it begins with a fundamental opinion that for our customers to transform and ultimately to succeed, technology will be critical to their strategies. We believe that as providers of technology to our customers. We also believe that as users of technologies within McKesson. As we think about our customers setting, Randy chatted earlier about the fact that the last 10 years of healthcare have changed, but we would argue that the next 10 years will change much more dramatically. And we believe that over the course of the balance of this decade, our customers will have to use technologies and ways to rapidly reduce their cost structures, to increasingly connect their communities, broadly speaking, and also to realize this change in reimbursement will probably be from a fee-for-service world to more of an at-risk world, being responsible for populations. And so these are big changes underfoot for our customers. In order for them to be successful over the course of the balance of the decade, they've got to use technology, and that's why Better Health 2020 means a great deal for us and our company moving forward.
Yeah. I mean, let's face it, healthcare is an information-based business. Everything that a physician or a provider does is ultimately based on information about you and your healthcare state. And today, all of that information exists in little piles. There's a little pile called a hospital's worth of information, or a pharmacy's worth of information, or perhaps a payer's worth of claims information. To solve problems like fraud and abuse, to take administrative cost out, to be able to manage a patient effectively over their entire healthcare experience in all of those settings, to manage populations of patients toward better outcomes, those require access to information at a very different level than we have it today. So a key part of this Better Health 2020 strategy is better connectivity, which really is a proxy for saying, how do we bring that information together from all of the different places it lives, be able to exchange it effectively, and put it to new use that today simply can't be had.
And the great unknown, I think, is how much the end user is going to want to have, is going to embrace consumer technology. There are already, I heard, 13,000 healthcare apps on the iPhone alone.
There are 13,000 apps out there, and all of them have access to very, very limited amounts of information. The magic happens is when you can pull the pharmacy data, the claims data, the clinical information, your personal health record, everything about your healthcare experience into one place, and then let the app writers go loose.
But I think it is really interesting to think 10 years from now how all that will come together. As a company, we have such broad capabilities, deep data resources, building analytics on top of that data, making it predictive in nature to really help to create that intervention with an individual about their health care, about how they personally manage that health care, about the lifestyle choices. We think the possibilities are really just terrific, and obviously technology will be at the core of it.